Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing a phenomenon known as hamstring super-cramping. So super-cramping is just a term that I came up with. It's nothing scientific. You won't read about it in a journal article or learn about it in PT school. It's just a term to describe a really, really bad cramp. Now, only a certain number of people that I've ever spoken to have had super-cramping. Anyone can get a cramp, and cramping can occur in any muscle, and it can certainly occur in the hamstring. That's pretty common. For example, you go out and sprint, and maybe it's hot out, you're a little dehydrated, deficient in electrolytes, you get a little hamstring cramping. Usually goes away pretty quick, right? Sometimes it happens in the calves for that. If you're in the clinic and you've been giving people bridges, right? The hamstrings are on active insufficiency during a bridge. Hamstrings might cramp up a little bit. Usually when that happens with a patient of mine, the cramp lasts no longer than 5, maybe 10 seconds at the very most, although usually it's much less than that. And it can be pretty easily resolved by doing a little hamstring stretch, go back to the bridges, and the person is fine. But the super cramp that we're talking about here, this is lasting longer than a minute, and it has been known in people I've talked to, including myself, I have experience with this, these can last anywhere from 5 to 10 minutes, and they're excruciating. I would say they can get up at least to an 8 out of 10, sometimes a 9 or a 10. Now, when we talk about pain severity, a 9 or a 10, that's the kind of pain severity where you should be in the hospital. And probably the only reason people don't go to it for this is they know it's a cramp and they know it's going to go away. And it always does. It just takes a long time. But the pain severity is definitely up there. If you had to live with this pain for a long period of time, you probably would go to the hospital. They're not fun by any means. So again, hamstring super cramping. They last longer than a minute, probably on the order of 5 minutes for most people. They're extremely painful, and they're also very hard to go away. A regular cramp in the hamstring, you can just do a little stretch, maybe knead it out with your fist, goes away pretty quickly. Sometimes you don't even have to do anything. You just stop what you're doing, and it goes away. These don't generally respond to stretches. They don't generally respond to kneading into the muscle, and if they do, it usually takes a long time for them to go away. It is not a hamstring tear. It is not sciatica. It is not an electrolyte deficiency or dehydration. So, if you come into the clinic and likely your chief complaint is not going to be the super cramping, it's going to be something else. It just happens to be brought out in the subjective or objective examination. But what things might you find for a person who describes something like this? Well, their cramping can occur with almost anything, okay? It could be random movements like rolling in bed. That's happened for me. It could be you're sitting in a chair with the knees bent and you just pull your foot back a little bit towards you. Like not a significant amount, just pull it back maybe 2 or 3 inches and the hamstring cramps up. It could occur during a hip extension type movement like you see here with the knee bent. When you perform a donkey kick movement like this, the knee is bent or flexed, putting the hamstrings on active insufficiency. And anytime a muscle is on active insufficiency, it is more likely to cramp. So something like this might do it. Heel slides or other knee flexion-based movements can do it. What you might also find, and this is very important for our argument here, is there might be weakness or poor motor control in the gluteus maximus. And there's a test that physical therapists like to do, and it is this. It is prone hip hyperextensions. You basically have the patient lay in prone like this, and they extend or hyperextend one of the hips up with the knee straight. And when you perform a hip extension movement, there's 2 major muscle groups that are at play. There's the gluteus maximus and the hamstring group. And if we had to assign percentages to these, it might be a little different than this, and I'm sure somebody's quantified it, but maybe the hamstrings contribute 40%, the gluteus maximus contributes 60%. What you often find with this test is that the person, even if they have strength in the gluteus maximus, they may have poor motor control over it. And so the hamstrings take over for this movement, and they're not effectively utilizing the gluteus maximus. That would be a motor control issue. Another issue would be the gluteus maximus is just weak. And so even if they had good motor control, it's weak. Hamstrings are going to take over. And when you do this type of movement where you have hip extension, which happens a lot more throughout the day than you think, the hamstrings get overworked. and they get overworked, and eventually it leads to some minor movement that you wouldn't expect to cause it to cramp up, and it is excruciating. And so the general treatment approach for this hamstring super cramping is improve the function of the gluteus maximus. We need to test if there's a strength deficit. We need to test if there is a motor control deficit, and in all likelihood, it's probably a combination of both. I really can't generalize this presentation to a particular type of patient because it is very common for patients to have weak gluteus maximus and poor motor control in them. That is a really common impairment that you see in the clinic. It is very rare that somebody comes in with strong glutes and able to use them effectively. That is not very common. So this situation where a person has poor motor control of the gluteus maximus with or without a strength deficit gets the term glute amnesia. And it's not like the brain has just forgot how to use the gluteus maximus. It's really just a motor control issue. And whether or not a strength deficit goes with that has to be determined. And so the general treatment approach here is to improve activation, strength, and motor control of the gluteus maximus, and really the medius, but the maximus is more important. And so when you perform anything that is hip extension based, well, the glutes will be able to play their part and the hamstrings will not get overworked. And so what you should see as the glutes get better strength and motor control, the hamstrings will stop cramping up like this. It's not going to necessarily eliminate cramps entirely, but it'll make them much, much less common. And if they do cramp, in all likelihood, it'll be much less severe and easier to get rid of them. And while there's many exercises that you can use that are not listed here, here's 3 good ones to try, and we're going to go over these right now. The first exercise that I often use to teach proper glute activation is a standing hip extension. And I'll usually start on this with no resistance band. So what you have the patient do is you have them come up to something they can hold on to. This is a squat rack. You can use a countertop, parallel bars at the clinic, something that's very sturdy. One of my past clinical instructors said that if you're trying to strengthen or teach muscle activation, you should take balance out of the equation. It's not that balance isn't important, but it's one extra factor that somebody has to worry about. We're trying to teach them the basics of activating the glutes. So take balance out of the equation. So start with one hand on something very sturdy like this. I have them put their other hand on the glute that we're trying to activate. We're trying to facilitate that mind-muscle connection here, which later on, once you master this, really isn't super important, but in the beginning stages, if you don't know how to activate it, it is very important. And you're going to have them perform a standing hip extension and try to feel for the glutes when they activate as you go into hip extension. Now, if they've got a lot of body fat there and maybe not a lot of muscle tissue, they may have to dig in pretty far. But you want to get them to the point where they're able to feel the glutes contract into their hands or into their fingers. Now, you notice one thing I'm not doing here is I'm not arching the back. If they start really arching the back, that's a compensation we don't want. Another factor here is when I go into hip extension, there is going to be a little bit of lumbar extension. You cannot avoid that, and you really don't need to avoid it. There's going to be a little bit, but when it becomes super excessive, that's when you need to stop and re-cue. So try to feel for that glute activation here. If they're still having trouble, you can also cue them to, as they bring the leg back, to slightly externally rotate the leg. Remember, the gluteus maximus also facilitates hip external rotation, okay? If that's insufficient, or if I just want to progress it a little bit, I'll throw a resistance band on here. You can do the resistance band around the thighs, but a lot of times I'll just throw it around the ankles because you get a little bit more resistance here. Same thing, hand or fingers on the gluteus maximus to feel for activation, and then we just go. It is okay if you feel the hamstrings working a little bit. They are going to work a little bit here, but the gluteus maximus should be doing most of the work. Now, a second exercise to help overcome motor control deficits in the gluteus maximus is the bridge. And there's other reasons this is a good exercise. One, it's a great warm-up for more advanced exercises, whether it be squats, deadlifts, hip thrusts, etc. But the bridge also can become the treatment once they master activation of the glutes through this. Now, with the bridge, some things that are very important here, okay? So with the bridge, if I just go up like this may or may not be doing any good, okay? Because it's very possible, if I have very poor motor control in my glutes, as I bridge up, I'm getting all hamstrings, or at least mostly hamstrings. Hamstrings get overworked, and that over the course of a day can help contribute to those awful hamstring super cramps. We want the prime mover here to be the glutes. The knees are bent here. That puts the hamstrings on active insufficiency. Hamstrings shouldn't be a major contributor here. It should be the glutes. Also, if the glutes are not contributing here, the hamstrings take over, they're on active insufficiency. This can cause cramps in this exercise. So if you're going to do bridges, if you're going to give them to anybody, it is really important that they're activating the glutes here. And one way to make sure that they're doing that is literally just to have them have their hands digging into their butt, just like we did with the first exercise. So again, bridge up, squeeze at the top. Do you feel these glutes? A lot of times patients will say yes, sometimes they will say no. If you're having trouble cueing them to activate the glutes, one quick fix for this that works for most people is to take a band and bring it up around the thighs, just above the knees. Now, when you're doing this variation here, okay, you don't want your legs the distance apart they are for a regular bridge. I actually want the feet apart a little bit wider than normal. What this is going to cause is the knees to try to collapse inward due to the band. So what you're having to do is press the knees outward. When you do that, you're already getting some of the glutes activated, mainly gluteus medius and minimus, but there is a little bit of gluteus maximus that gets activated here, okay? And so then, from here, hands on the floor, I'm going to then bridge up while I'm maintaining this outward squeeze of the knees, bridge up, and a lot of times that is sufficient to make the patient feel their glutes activate, and then come back down, okay? This approach to glute activation, you can do for all sorts of exercises. It's not just the bridge. You can throw that in for hip thrusts. You can throw that in for squats. You can throw it in for good mornings. This works great. It's just that if a patient has a motor control deficit, you probably want to start with a basic one like the bridge. Now, the third exercise, but by no means the last one to teach proper glute activation, is the Roman chair. This is actually my favorite of all of these. It is really effective at teaching it. It may be too advanced for some patients, but if you are watching this video and you're a little bit higher level, you're in the gym and you're like, you know what, I don't really feel my glutes activating. Most gyms have a Roman chair. Check this out. This is really good. I actually used this after an ankle surgery I had to remove an os trigonum, and I had right-sided glute weakness and some impaired motor control, especially on that side, and this helped me out a ton. So you're gonna get in the Roman chair, okay? And the overall movement looks like this. So I'm starting down here, and as I come up, I am making sure I'm squeezing the glutes. I'm really trying to squeeze those, okay? I am not arching my back. Sometimes you'll see this. Now, this is not an inherently bad exercise if you're going for paraspinals of the low back, but we're going for glutes here. So we're going slower, controlled, squeezing the glutes at the top. Again, just like any of these exercises, you can put your hands back here on your glutes. So come down to the bottom and really squeeze them as you come up to the top. This exercise actually worked faster for me for getting proper glute activation than the bridges or the standing hip extension. This one is really good. It's such a tough exercise that it literally forces you to use the glutes. The hamstrings will still work, but realistically, you're lifting basically half of your body weight, which is your torso and up. So your glutes really have no choice but to activate, so you're kind of coercing them into activating. Again, this can also become the treatment. This can become the exercise to strengthen them. You can obviously add weight. You can hold a weight in your hands. There's a couple other ways to make it more difficult. One way, instead of having your arms like this, is to have your arms behind your head. Like I said, you can obviously hold some weights in your hands. You can hold a barbell, some dumbbells, a kettlebell, etc. The last way you can make this more difficult is by turning it into a single leg Roman chair extension. Now, with glute amnesia, a lot of times people also have issues activating the gluteus medius, which helps you go more out to the side rather than back. And so if you turn this into a single leg exercise, you're going to also get a lot of gluteus medius activity in addition to maximus. So I'm going to do a left single leg so you can see. So I'm going to get in position here, and I'm going to be working my left side. The right side is behind here. It's not anchored in. So this is going to be pretty much entirely left hip extension. So same idea here. Come down. Try to keep your pelvis from rotating. Try not to do this. Keep level. Squeeze up at the top. Again, you can put one hand on the glutes here. Squeeze. Squeeze. And again, you can progress these in the same way. Hands behind the head. Hold some weights, etc., etc. Is a conventional deadlift a good exercise for teaching activation and then motor control of the gluteus maximus? For most people in the world, no, it is not. If you have good motor control and good activation of those muscles, then doing it is a great way to strengthen it. But if you don't have good motor control going into, let's say, a deadlift, you're likely to get a ton of hamstring overuse in that exercise. It's not saying you're going to get a hamstring injury, but you're likely not benefiting as much from the deadlift as you would if you actually had good control through the glutes. So what do we use instead? Well, the best exercises normally are either unilateral glute exercises or hands-free glute exercises. Unilateral in the sense that we want to iron out any side-to-side differences, because often there are. And usually with a unilateral glute exercise, you're going to have a hand that's free to put on your buttock and be able to feel the glutes activate. If it's a hands-free exercise like a bridge, you can put your hands on both glutes and be able to feel those glutes activate. When we are doing advanced strengthening, assuming we already have good motor control, the mind-muscle connection is not really as important as most people think. If you've got good motor control, you don't have to volitionally think about activating these muscles. They're just going to activate and you're going to strengthen them. But if you don't know how to activate these, it is very important to facilitate that mind-muscle connection early on. And so that's why we want to use these unilateral or at least hands-free glute exercises, so you can put one or both hands on those glutes, feel the muscle contract and facilitate that connection, so it becomes much easier to activate that muscle later on down the line. So hopefully this video gave you a good understanding about how to cue glute activation and sort of get rid of that glute amnesia that might be contributing to hamstring super-cramping. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.